What is the RBC count? Well, the red blood cell count is the actual measurement of red blood cells circulating in the blood, and it provides another way of assessing oxygen carrying capacity, complementing hematocrit and hemoglobin. Red blood cells are essential for carrying oxygen from the lungs to the tissues and carbon dioxide back from exhalation. A low red blood cell count typically indicates anemia, while a high count suggests conditions like polycythemia or chronic hypoxia. Understanding red blood cell counts are foundational for interpreting the rest of the CBC. Normal red blood cell counts differ by sex and age. For adults assigned male at birth, we see 4.7 to 6.1, and this is million per microliter, while those assigned female at birth, it's 4.2 to 5.4. Children and pediatric reference ranges vary. Infants under 1 have slightly lower ranges, and newborns and very young infants often have a higher red blood cell count, reflecting their increased oxygen demands at birth or right after. These values provide context when determining whether a count is truly abnormal or simply appropriate for the patient's age or physiologic state. Critical thresholds apply here as well. A hemoglobin below 7 grams per deciliter. Okay, here we go. Now we're back on track. The red blood cell count is part of your standard CBC and is ordered routinely. Specific indications include evaluation of anemia, whether blood loss, hemolysis, or production problems. It's also used when monitoring patients with ongoing bleeding, such as GI hemorrhage, and in hospitalized or critically ill patients, the RBC count is often followed serially to assess trends over time. Like hematocrit and hemoglobin, red blood cell counts are measured from an EDTA containing lavender tube and no fasting is required. There are factors that can interfere, like pregnancy can lower values due to dilution and sometimes nutritional deficiencies, and certain drugs can raise or lower counts, as you can see on this screen. Erythrocytosis or an increased red blood cell count may reflect either physiologic adaptation or disease. Chronic hypoxia from congenital heart disease or COPD stimulates the bone marrow to produce more red cells in order to improve oxygen delivery. Polycythemia vera is a bone marrow disorder where red cell production is abnormally high. Severe dehydration, it concentrates the blood, falsely elevating counts. And certain hemoglobinopathies, such as thalassemia trait, also drive higher red blood cell counts because the body tries to compensate for abnormal hemoglobin by producing more cells. The key to interpretation is always the clinical context. Decreased red blood cell counts parallel in decreases to hematocrit and hemoglobin, so a lot of crossover here. Causes include anemia, hemoglobinopathies that reduce red cell survival, cirrhosis and chronic fluid overload, hemolytic anemias that also destroy cells prematurely, and acute hemorrhage can lower red cell counts, although it may take hours for the lab value to fully reflect the blood loss. Additional causes can be nutritional deficiencies like iron, folate, B12. They impair production, mechanical destruction through prosthetic valves, kidney disease due to EPO issues, which will normally stimulate red cell production. Finally, normal pregnancy, as I mentioned, causes that dilutional effect. And lastly, chronic illness and bone marrow failure are other major contributors. Rheumatologic and collagen vascular diseases can suppress red cell production over time, and bone marrow failure syndromes will reduce synthesis altogether. Certain malignancies like lymphoma, multiple myeloma, leukemia, and Hodgkin's disease can crowd out the normal healthy marrow, and that leads to less red cell production. These conditions are critical to consider when low blood cell counts persist despite correction of reversible causes.